Member Sanders and members of the committee, thank you for the opportunity to be here. It is an honor. Abortion is a subject of intense interest, debate, and legislative action, and so we need to give grave consideration to its risks and purported benefits. Mifepristone misoprostol is now the predominant method of abortion, accounting for almost 60% of abortions in 2022, and we now have data to document and examine negative outcomes associated with the use of chemical abortion. We all know that the regimen includes both mifepristone and misoprostol, and this is associated with significant short and long-term physical and mental health harms to women. These are documented by international studies as well as studies in the United States, including studies in the Scandinavian countries, which are not pro-life countries. The different risks that are associated are bleeding, infection, hemorrhage, need for transfusion, and perforation. Now, while perforation is not a risk with chemical abortion alone, an estimated 6% or 1 in 17 women will require surgical intervention, and these women are exposed to both the risks of chemical and surgical abortion. In the UK, an estimated 10,000 women per year were treated in emergency rooms in 2022 and 23 for complications arising from an abortion. Another risk is undiagnosed ectopic pregnancy. There have recently been documented deaths from chemical abortion. Abortion in general, including mifepristone misoprostol, is associated with serious psychological and social harms for women. A recent study in Canada by Dr. Auger and her colleagues found that it markedly increased the risk for inpatient psychiatric admission, the most severe diagnosed forms of mental health. It is also associated with sex trafficking, child sex abuse, and domestic violence. I'm aware of a case of a young girl who was age 16 who came in with severe sepsis to the emergency room. When queried about what was the cause of her missed abortion, it turned out that she had been given abortion pills by her teacher, who gave them to her in Skip Town, presumably to do the same thing to another one of his students. And abusers have been known to force abortion pills down women's throats, put them in their drinks, and insert them into their bodies. Mifepristone and misoprostol mifepristone is not safer than Tylenol and should not be made available over the counter. Tylenol is an over-the-counter medication. It does not have a black box warning. Most problems with Tylenol are associated with accidental or deliberate overdose. Mifepristone side effects are associated with routine prescribed use. Elective abortion is intentional feticide. It is not the same as care for an ectopic pregnancy, which is treatment to save a mother's life. It is not the same as care for an in utero demise where the fetus is already demised, and it is not the same as care for miscarriage. Abortion in African American women is a pervasive problem. There's a remarkable racial disparity in abortion rates between African American and European women in many states. In particular, in some states, approximately the rates are 3 to 5 times of abortion in Black women compared with white women. The practice of standard telemedicine is highly regulated, and therefore the prescribing of abortifacient drugs virtually should not be legitimized by calling it telemedicine. This is more properly called remote abortion. In these cases, a woman cannot have her pregnancy accurately dated. The woman cannot be assessed medically. I would like to conclude by stating that our concern is for the woman, and access to any medical intervention should never come at the expense of safety.